Hi everybody, I am Dr. Victor Menezes from Mithi Surgery Hospital, Mysore. I have done my MBBS from St. John's Medical College, Bangalore, MS from Tata Memorial Hospital and KEM Hospital, Bombay. I have done my FRCS degree and worked for 3.5 years in London. Also from National Law School, Bangalore, I have done postgraduate diploma in medico-legal studies and ethics. Today we are going to discuss regarding varicose veins which affects the lower limbs. You can see this is very severe varicose veins here, and what is varicose vein? Is very difficult for the blood to go up in the lower limb against the gravity. That's why there are two systems of veins. One is deep system which is situated in the muscles, other one is superficial system which is situated in the fat beneath the skin. For the blood to go up from the superficial system and then from outside to inside and again in the inner system from down upwards, there are valves which are kept. This does only one way blood circulation. When these valves get affected, there is a lot of pressure within the muscles and hence the blood gets accumulated in the superficial system and they get dilated and form the varicose veins. And this is a varicose vein picture. This is varicose vein with normal limb we have seen and varicose veins here without complication. Once varicose veins are there for a long time, the electrolytes, fluid gets out of the blood and deposits in the subcutaneous tissue and becomes edematous, and it can get infected again and again. Also blood clot may take place and infection will take place. And as the days pass by, the iron which is there in the red blood cells of the blood gets deposited in the skin as well as the subcutaneous tissue. And as the color increases to black, it becomes almost like a gangrene. So whatever we take medicines doesn't come, the oxygen doesn't go, whatever we eat doesn't this. And then the skin gets open and ulcer is formed like this. This is the foot ulcer, and this never heals even if you take good dressing and medical treatment. Lots of us believe that if we put stockings, the varicose veins are treated. No, it is only matter of postponement of the complications of the varicose veins. It doesn't get treated. If the damage is going to take place in 2 years without stockings, and with the stockings it may go on to 3rd or 4th year. That's why whoever got varicose veins without damage, you need treatment. What we do, we get a Doppler color scan on the lower limb, and while doing the Doppler color scan, we mark the area which are bad veins or veins which are damaged by varicose veins. And olden days we used to cut here and there and pull the entire vein which was abnormal, and this is called stripping, and it used to give rise to lot of pain. You can see here the vein is being cut. This is a picture of the vein which is seen outside the body, and this is the area of the scar, multiple scars seen in the open operation for varicose vein. Now what we do, after mapping or marking, we pass the laser fiber without making any cuts or wounds, and pass the laser fiber along the abnormal vein and pass the laser energy within the lumen of the vein, and then if the vein gets blocked. This is the picture before laser. This is the laser fiber in the abnormal blood vessel. Laser energy is being given and the entire blood vessel seals off, and this is the post laser treatment or post laser lower limb. Today we are going to learn what is laser. As you know, on the radio at different wavelength we listen to different stations. Similarly, the light has got different wavelengths, and this particular medical device gets 1470 nanometer energy into this fiber, and at the tip you can see the red light. From there the energy will be released when I press this foot pedal. This laser energy is going to act on the blood vessels by either water or blood effect, and it makes the blood vessel shrink. That's why it can be used in various treatments of piles, varicose veins, fissures, fistula and sinuses. Laser energy is extremely safe. The reason being, this laser energy has got effect for only 4 millimeter from the tip, and hence there is no damage to the surrounding structures, and hence there are no side effects. It is so safe that it can be used even in pregnancy and children. This is how it looks clinically. This is before laser treatment, this is after laser treatment. Almost there is no scar, looks like a normal. And in the laser treatment, the patient returns almost home because the same day, because there is no pain. In the open surgery, pain will be there for quite a few days, and patient will have 8 to 10 score and other problems. What are the advantages of laser treatment? Laser treatment is very safe because it gives the effect to only 4 millimeter surrounding the fiber. So there is no side effect for surrounding areas. This can be safely used even pregnancy and children. Since there is no pain, patient will return home immediately few hours after the treatment. He can return back to his studies or work at the earliest next day, and there is no wound, there is no bleeding, there is no chance of infection, and very safe, and indirectly you will be spending much less money since you will return to work at the earliest. This is very safe and has got the highest success rate compared to all other treatments. There is no need for you to come back to the hospital. I hardly see any patient coming for a revisit. Today you have listened all the information which was possible to give you, and hope it is very helpful. Any of you have any of these problems, need treatment or need further information, kindly contact. I am Dr. Victor Benezes from Mithi Surgery Hospital, Mysore. Thank you for watching, and any of you need any further information, kindly contact this center.